Hey men, research shows that up to 70% of you will develop some sort of sexual dysfunction in your lifetime. But what many don't realize is it's a simple habit that you're doing every single day that could be to blame. And so in this video, we're gonna talk about what it is, what you can do to address it, and what are the risks if you do nothing about it. I'm Hina Sheth. I've been an orthopedic and pelvic floor therapist treating sexual dysfunction in men for over 24 years. This everyday habit is related to bad posture. And I know this seems so simple because most people associate bad posture with things like low back pain or head and neck pain, but bad posture can actually lead to sexual dysfunction. And in order to understand how bad posture is related to sexual dysfunction, we have to look at a group of bones known as your pelvis. And your pelvis is comprised of 3 bones, 2 iliacal bones in the front and the side, and a bone in the back known as your sacrum. And they form 3 joints, 2 sacroiliac joints in the back and 1 in the front known as your pubic symphysis. And together they form this bowl type structure. And within this bowl structure is a group of 14 muscles known as your pelvic floor. And these pelvic floor muscles are crucial for things like bowel function, bladder function, and sexual function. And if there is any type of imbalance within these group of muscles, such as weakness or tightness or a combination of both, they can lead to sexual dysfunction. Bad posture will essentially affect the tilt and the rotation of your pelvis. So if we look at the pelvis from the side, any sort of angulation of the pelvis, whether it's forward, known as an anterior pelvic tilt, or backwards, known as a posterior pelvic tilt, will affect the muscles of the pelvic floor. But not only that, remember I talked about there's 2 joints in the back, known as your sacroiliac joint and the pubic symphysis. Within the pelvis, you can actually have movement of those bones as well. And when you have movement of those bones, they can cause rotational imbalances within the pelvis as well, affecting those pelvic floor muscles. There are many different types of improper posture, but let's look at one of the more common ones. This is known as the anterior pelvic tilt, and this is where the pelvis is tilted forward. Now, reasons for why someone may develop an anterior pelvic tilt, there can be many, but for an example, if there's any issues up in the head and neck, for instance, a forward head and neck, that can create changes within this angulation of the pelvis. But if there's also other hip, knee, or foot related injuries, dysfunctions, post-surgical things that have happened, that will affect that pelvic tilt as well. That pelvic tilt will end up affecting the muscles of the pelvic floor, which will then potentially lead to sexual dysfunction issues. But let's look at another common postural habit, and that is related to sitting. I can't tell you how many patients that I've seen over the years with poor posture in sitting. And so many of us are at desk jobs or sitting at a computer for hours and hours at a time. So how many of you guys sit like this? Or like this, a slumped type posture. And that slumped type posture will affect the tilt of that pelvis. So when you are in a tilted or a slumped posture, then you can see that it will affect that angulation of the pelvis, affecting the pelvic floor. But not only the angulation of that pelvic floor, but just sitting for hours on end on those group of muscles can cause a lot of compression of your pelvic floor, leading to imbalances not only from the tilt, but also from the compression over time. Improving your posture is not just standing up straight. It's about making small, consistent, incremental changes every single day in the way that you hold and move your body. Let's look at some effective tips to help improve that posture as well as the balance of your pelvic floor, which will ultimately improve your sexual health. Tip number 1 is gaining awareness and understanding of your posture in standing so that you can make subtle changes over time. The easiest way to do this is have a friend take a side profile picture of yourself from head to toe. Now you want to create some markings on that image. 1 at the ear, 1 at the midline of the shoulder, at the midline of the rib cage, midline of the hip, the prominent knee bone, and the prominent ankle bone. And you want to connect these dots together. Ideally, what we should see is that there is a straight line going from your ear all the way down to your ankle, creating an ideal posture. Any deviations from that straight line is going to now give you some awareness of where your posture is and how far deviated it is from the ideal standing posture. And this way you can now start to make subtle changes. If you notice, for instance, that your head is more forward. Every day you can do subtle things like just thinking of a ponytail that is lifting your head up towards the ceiling to bring that head and neck back into a better alignment. Or if your knee is, say, a little bit more hyperextended and falling back of that line, you can create a soft bend in your knee to create subtle changes that change your whole standing posture. Tip number 2 is improving your sitting posture as well as creating an ergonomic setup. Ideally, we are aiming to always sit on our sit bones. Our sit bones are the most prominent bottom structure of the pelvis. They're located right here. When you aim to sit on your sit bones, they create the ideal pelvic neutral, meaning that the pelvis is not too far tilted forward or tilted back, creating a nice shelf for those pelvic floor muscles to rest on, preventing excessive compression to the front or to the back of that pelvic floor. Next, you want to create a 90-90 degree angle from your spine to your hip and knee, and from your hip and knee down to the floor. This will then create a nice resting posture for your head to rest on. And as far as your work environment, many companies will actually have an ergonomic specialist that can come and help you set up your desk in the most ergonomic and efficient way. So make sure that you ask if that is available to you. Tip number 3 is stretching. There are so many muscles that connect onto the pelvis all around the body. And if any of those muscles are tight and restricted, they can enhance a poor pelvic tilt or prevent you from getting into your most ideal posture. Incorporating stretching for your upper body and your lower body, or even engaging in activities such as like yoga and Pilates stretching a few times a week can make a tremendous improvement over time in your posture and your pelvic floor. Tip number 4 is get moving. So many of us are sitting for hours on end due to our jobs or because we're doing certain tasks that we get fixated on and we don't give our butts a break. And so the easiest thing you can do is every 20 to 30 minutes, set a timer on your phone. Get up, do some of the stretches maybe that I talked about in my previous tips, or take a walk around the house or your office, or get a glass of water and hydrate, but get off of your butts because that will take off the compression of your pelvic floor and will also get you out of that slumpy posture that we might get into the habit of after sitting for so many hours. And if you want to take it a step further, you can even think about getting a standing desk. So this way, if there is something that you have to do, but you don't have that time to take to do stretches or take a walk, then at least you're getting compression off of your pelvic floor and you're getting out of that slump posture. And if you want to take it even further, one more step, then they even sell treadmills, little walking treadmills that you can place underneath your desk to also get some exercise in it, because why not? Maintaining good posture is not just a quick fix or about looking good throughout the day. It's actually substantially important for your sexual health and your overall well-being. Improved posture leads to better pelvic floor balance, and better pelvic floor balance leads to improved sexual performance. But it also helps with bowel and bladder control and core stability. But not only that, it also prevents premature ejaculation as well as helps prevent erectile dysfunction. In addition, better posture and pelvic floor balance improves overall circulation, reduces pain and discomfort, improves your overall self-confidence and your physical health. And don't take my word for it, the Department of Urology at Mayo Clinic also agrees with what I am saying. Improving your posture is one of the first and simplest steps that you can take. But if you're looking to truly maximize your potential in bed, then check out our next video. And if you're looking to solve your pelvic floor issues for good, then check out our course specifically designed for you.